So, radiation therapy is also called radiotherapy. Uh, it's a cancer therapy that uses high dosage of energy in order to kill the cancerous cells and tumors. When the energy of radiation is small, it is used in X-rays to grasp whatever is obstructed in our body. As these X-rays, they can detect the broken bones. However, at high amounts of radiations, they kill cancer cells, or at least reduce their expansion by destroying their DNA. A cancer cell in the DNA injured beyond healing stops dividing or dies. So when the cancer cell is endured, it dies, and these cells are broken down and and detached by the body. This radiation therapy does not execute cancer cells right way. It certainly takes days or weeks of cure before DNA is injured, enough for cancer cells to die. So the cancer cells keep falling like dead leaves falling from the trees for weeks or months of radiation therapy finishes. There happen to have two key types of radiation therapy: external beam and internal. The type of radiation that we use, it depends on many factors. Those are the size of the tumor, uh, the general health, the general medical condition, and the medical history. The type of cancer, the tumor's location in the body, and how close the tumor is to the normal tissues. That certainly dictates us how to uh, irradiate these cells. The external beam radiation therapy, it derives from a machine. It comes from a machine that targets radiation at the cancer sites. The machine is basically a huge thing, and maybe allowed, and probably we call them as particle accelerators. And these accelerators can be huge. It doesn't trace you, but can move everywhere, sending radiation to a part of our body in many directions, in many ways. However, in case of internal radiation therapy is a usage in which a source of radioactive material it is put inside our body, and the radiation sources can be denser, they can be fluid-like. This internal radiation therapy with the hard source, we call it therapy. I mean, in this method of treatment, ribbons, seeds, or capsules that contain a radioactive source are placed in our bodies near to the cancer sites. In a similar way as it is done in case of external beam radiation, this brachytherapy is a native treatment and treats only a precise part of our body, external, internally. And from external beam radiation treatment, it is a local treatment, which means uh, uh, it is given at a specific part of our body. For example, if we have a tumor in our lung, we will have radiation only to our upper body part, and not to the lower body part. For some people, radiation may be the only cure, but we need, but most often we will have radiation therapy with other tumor treatments like surgery or immunotherapy or chemotherapy.